Today we're here to talk about concussions. So let's see what Rex has to say. What is a concussion? So a concussion is a type of brain injury. The concussion results in a metabolic cascade that then results in symptoms and functional difficulties. So it's important that you see your healthcare professional to have an assessment to see what types of areas might be affected following a concussion. Okay, moving on, let's see what else Rex would like to know about. How severe can concussions be? Can there be lifelong effects? Most people recover from concussions in the initial days to week following injuries, but up to 30% of people might have symptoms that last for more than 30 days. And in these cases, treatment is warranted, and that might include aerobic exercise, cervical and vestibular rehabilitation, and in some cases, a team-based approach. Concussion's a treatable injury, and these different types of treatments can help facilitate recovery. What are the most common causes of concussions? The highest risk of concussion occurs in sports that involve contact or collision, with high rates reported in football, rugby, ice hockey. There's also other causes of concussions that occur outside of sports, such as a motor vehicle collision, slips and falls, and in some cases also from intimate partner violence. Okay, how can we prevent concussions? So some of the common ways that concussions can be prevented are through changes in rules or policies within sport, through protective equipment, such as wearing a mouthguard, and through training strategies. There's research that shows that neuromuscular control training can decrease the risk of concussion substantially. Through these strategies, if we can decrease concussion, we can optimize also the ability of people to continue to play sport.